Chronic inflammatory enteropathy is a term that you may see used more now, typically in place of the term inflammatory bowel disease in dogs and a little bit in cats too. And we've sort of moved away a little bit from the term IBD since it is a human term and these disorders are fairly different in dogs. And so this is a terminology that we use when there's been gastrointestinal disease present for a duration of 3 weeks or longer. So that means clinical signs supportive of GI disease, like vomiting and diarrhea and weight loss and changes in appetite. And then you've reasonably excluded obvious other causes like parasitic disease and neoplastic disease. And then that number one, you could say that and call it a chronic enteropathy. When you add the term inflammatory, that means you've biopsied the patient. And so that's where number two comes in for the term CIE, is that you also have histologic evidence of intestinal inflammation. So generally, we use the term chronic enteropathy for a dog who meets the criteria for point number one. Once we've biopsied them, we tend to use the term chronic inflammatory enteropathy. So we add that inflammatory. And largely, you'll see that terminology more and more these days instead of the term IBD. When we say IBD, it does imply a histologic diagnosis. So then you don't really have a good term for dogs that you haven't biopsied. So that's where you can use chronic enteropathy. And then we typically will add inflammatory once we've achieved a histologic diagnosis.